The updated Mammography Quality Standards Act will significantly change how breast density is reported on mammogram results and communicated to patients. Are you curious about how these changes will impact your breast imaging center? Hello, it's Rick, and I'd like to invite you to join me in this mini moment as we dive in and take a closer look at the specifics contained within the MQSA regulations identified in Section 900.12, Paragraph C, Subparagraph 1, Subparagraph 6 about the standardization of breast density reporting in all mammograms. This section of the regulation states that for each mammogram, one overall assessment of breast density from the MQSA lexicon of dense breast categories is to be selected and included in the test results report. What's included in the dense breast MQSA lexicon? Well, there are 4 descriptive phrases the interpreting physician has to choose from. However, before we start, let's look at what breast density refers to. Breast density refers to the proportion of fibrous and glandular tissue compared to fatty tissue in the breast. The first descriptive phrase in the lexicon is, "The breasts are almost entirely fatty." This accounts for about 10% of patients having mammograms. Next is the phrase, "There are scattered areas of fibroglandular density." This category makes up approximately 40% of patients having mammograms. The third descriptive phrase is, "The breasts are heterogeneously dense, which may obscure small masses." This category also comprises approximately 40% of patients having mammograms. The last descriptive phrase in the breast dense lexicon is, "The breasts are extremely dense, which lowers the sensitivity of mammography." This category rounds out the remaining 10% of mammogram patients. In addition to the test results report, the updated Mammography Quality Standards Act regulations have unified the patchwork of state laws concerning breast density notifications to patients into a national standard in the Mammography Lay Summary Letter. This ensures that all patients receiving mammograms and their referring healthcare providers are informed about their breast density and its implications. This national standard mandates that all mammography facilities provide transparent and standardized information about breast density. It ensures that every patient receives the same vital information about their breast health, regardless of where she lives. It is essential to point out that while the national law sets a minimum standard, it allows states to create or uphold more stringent regulations. This concept of state autonomy means any state with existing comprehensive breast density notification laws, or one that would like to create one, can maintain its own higher standards, ensuring that patients receive the most thorough information and care possible as long as it meets the national standards. In fact, while most states with breast density notification laws are sunsetting their current rules and adopting the national regulations as their single standard, several states are choosing to keep their current standards. This means mammography facilities in those states must include state and federal patient notifications in the Mammography Lay Summary Letter. This means mammography facilities in those states must include state and federal patient notifications in the Mammography Lay Summary Letter. So, if you are a mammography facility in a state with a dense breast law, be sure to check with your state authorities if you have any questions about how they are dealing with state autonomy on this issue. From the updated MQSA regulations perspective, Section 900.12, Paragraphs C, Subparagraph 2, Subparagraphs 3 and 4 of the updated MQSA regulations provide clear details about what each mammogram lay summary letter must contain regarding breast density. If the mammography report identifies the patient's breast density as "the breasts are almost entirely fatty," or "there are scattered areas of fibroglandular density," the lay summary shall include the statement, "Breast tissue can be either dense or not dense. Dense tissue makes it harder to find breast cancer on a mammogram and also raises the risk of developing breast cancer. Your breast tissue is not dense. Talk to your healthcare provider about breast density, risks for breast cancer, and your individual situation." If the mammography report identifies the breast density as "the breasts are heterogeneously dense," which may obscure small masses, or "the breasts are extremely dense," which lowers the sensitivity of mammography, the lay summary shall include the statement, "Breast tissue can be either dense or not dense. Dense tissue makes it harder to find breast cancer on a mammogram and also raises the risk of developing breast cancer. Your breast tissue is dense. In some people with dense tissue, other imaging tests in addition to a mammogram may help find cancers. Talk to your healthcare provider about breast density, risks for breast cancer, and your individual situation. The interpreting physician must now ensure that breast density information is included in every mammogram report using one choice from the designated MQSA Overall Breast Density Lexicon. This standardization helps provide consistent information, enhancing referring healthcare providers and patient understanding and compliance with follow-up recommendations. Primary care physicians and other healthcare providers must be ready to discuss the implications of breast density with patients and guide them in making informed decisions about additional screening options. They must also promote a collaborative approach to patient care and improve the overall management of breast health and early detection strategies. Mammography facilities must update their protocols to comply with the new national standards and ensure that all patients are informed and appropriately communicated about the breast density reported on their mammograms. Meanwhile, the national standard ensures that all patients receive crucial information about their breast health, enabling them to make informed decisions and proactively manage their health. Understanding the updated MQSA regulations and the significant step forward in standardizing breast density notifications across the United States is vital for every mammography practice. This milestone now ensures that all mammography patients and their referring healthcare providers will be uniformly informed about their breast density and its implications for breast cancer screening, no matter where they obtain their mammogram in the United States. If you like this, please give it a like. Also, make sure to subscribe for more bite-sized information about other mini moments. Do you have an opinion or idea about something you want to hear about? Please leave us a comment. To get references to the information used here, check out the link to our Knowledge Hub below. Until next time, continue striving to enhance patient outcomes by delivering compassionate and precise breast imaging care.